All right. Well, welcome everyone to our June 3rd all-member town hall that we're doing statewide here. This is the UPTE-CWA 9119 monthly meeting where we gather together to get some updates, and we have some really good ones for you today. So I'm looking forward to sharing some information with you myself. My name is Joaquin Chavez, UPTE Vice President, but also with us today, of course, are Jamie McDowell, UPTE President, and we are also going to hear from Eric Wise, our RxTX Coordinator with the Systems Administrators Bargaining Update. And you're also going to hear from our national headquarters at CWA HQ. You're also going to hear the Public Sector Assistant to the Vice President, Thomas Walker, who's going to present some information about the American Rescue Plan and the opportunities that we in UPTE have to fight for some premium pay for those who have worked through the pandemic conditions. So we're really excited to talk to you about that and answer some questions towards the end of the program. Without any further delay, I wanted to go ahead and hand it off to Jamie. She is going to open up with talking about the paid family leave and bonding that is available now at or coming up very shortly at UC. So Jamie.
Hi, everybody. Yeah, so the University of California has been putting out some information. Some of you may have seen some of it about the new program of pay for family care and bonding. So first of all, I just want to say, UPTE, we're totally taking some credit for this. We fought for 2.5 years at the bargaining table for this basic program for care or pay during FEMLA, caring for family members, paid for baby bonding. We had in our contract prior the right to take time off for both of these, but no pay associated with it. It required leave, any accrued leave that you may have. We took this all the way to the hearing that was involved when fighting for our contracts when they went into impasse. And during those hearings, there were discussions with UC's top administrators of really making a serious push and looking into what this would require. They were talking at that point that they may have to build it into the our disability. We are paid for disability that us as employees pay for, and then it would be built into that cost, probably increase our premiums, and it would be a cost, an expense to the employees. So fast forward to 2021, UC decided and made the decision to provide pay to employees at no expense to us. So this is a fully funded University of California benefit. So some of the requirements and a lot, just so you know, some of the details are still being worked out, even though they are rolling this out in less than a month. But some things I can tell you. So you have to qualify just like you would for FEMLA. So meaning you have to have been employed at the university for 12 months. You have to have worked at least 1,250 hours in the last calendar year. FEMLA gives you up to 12 weeks of protected time off for your job, guaranteeing that your job will still be there. This only provides 8 weeks of pay. So it's a start, okay? It pays you out at 70% of your base salary. So if you're getting shift differentials, on-call rate, things like that, that is not included. It's your base salary, 70%. It is taxed. You accrue still service credit at 70%. You accrue your benefits like your sick time, your vacation time at 70%. So you'll actually be accruing time, vacation, sick time while you're on this leave. If you fall below 50% of pay, so if you are a part-time employee, this is prorated, as is the requirements to qualify, except for the 1,250 hours. But if you're part-time, they do prorate it. If you fall below 50% of pay, then UC is not paying your healthcare premiums. Just so something to keep in mind. You're required to use this in blocks of 1 week. So horrible situations, say, for example, family member has cancer, you take time off for like chemotherapy, you have to take a full week block. You know, a lot of times those treatments are staggered. So, you know, they get a treatment 3-4 weeks later, they get a second one. So you take a block off when they get their treatment. You go back to work for a few weeks, then you take another 1-week block. Or if it's something more catastrophic that you need to take a solid leave, that's fine as well. But they have to be used in 1 block increments, up to a total of 8 weeks. So if you use 2-3 weeks and then come back to work, you still have the remainder of that 8 weeks for that calendar year. Per diems, I saw someone pop up per diems. Per diems would qualify if you hit that 1,250 hours. I know a lot of our per diems work a lot of hours and the 12 years of the 12 months of service. So if you hit that 1,250 hours, you're still eligible. You cannot supplement that 70% with accrued leave. So you can elect, if you're a person who's been at the university for a long time and have a huge bank of leave, then you can take that time and use your leave and take full pay. But you cannot like use 30% of your leave to supplement and get to 100%. The university, that's one of the things that that I was really pushing for because, you know, I think you back to those days when I had babies and worked at somewhere else, and you could do that with the state disability, but the university said no, we cannot do that. And honestly, I think it's part because they couldn't figure out how to do the calculations. But that's just me. So you can use your leave if you run out of leave and then use this. That's an option, but it's either or. This is not for your own illness. So if you did not sign up for disability when you were hired, you cannot use this as pay for your own illness. I saw someone ask if it's for maternity. This is not for maternity. Maternity leave is considered disability. So you go on disability. Now, when that disability time for having your baby is over, then you can roll into baby bonding time. And that's gives you additional time. You can, at that point, use this leave. So disability, this can build on disability and then baby bonding, or disability because you had you got ill and then a family member got ill, you can move it over to this for care for another person. But it's good for care for a family member for under FEMLA, and all the terms about FEMLA, family relations, etc., is all in our contract. It's also good for that parental bonding or baby bonding. So that's both partners. And you know, a lot of times you see there's couples work here, both qualify for parental leave, and both can use this leave as pay. Military caregiver leave. That military caregiver leave gives you up to 26 weeks of leave for a partner who gets deployed, but this only covers 8 weeks of pay. And then qualifying extingency leave, hardly anyone ever uses that, but it is an option. And so again, it only gives you 70% of your base salary. So it is a noticeable 30% cut basically to your take home. And then if you have any differentials or anything else on there, that's all not paid as well. So that's kind of the brief summary. I just finished it up this morning working with Sam, our communications guy. Thanks for the help. Like a kind of written out paper that we'll put up on our website so that everybody can kind of refer to it. It also gives you an idea of the difference between disability and this. Again, disability is for your own illness. This is for a family member's illness or baby bonding, but there are some kind of tweaks different. So I just wanted to give that comparison to people so that you could know. So I'm going to turn it over back to Joaquin at this point. I will look through the chat because I saw some more questions popping up, and add those and we can address them at the end.
Great, thanks, Jamie. I know, yeah, there are a lot of questions about implementation, and so we're going to be working to make sure that everyone has all the information that they need. So thank you for making it. And, the most that we can ask you to do with this is also share it with your coworkers, let them know. And there's going to be a recording of this that's going to be posted later. So folks who couldn't make it here, couldn't participate in the conversation, they'll get a chance to review this as well. But we really appreciate you all being here. So for the next part in the agenda, and there's always a lot to cover here, so we're a couple minutes behind, but we got plenty of time for Thomas Walker, assistant to our public sector CWA Vice President Margaret Cook, who has joined us for several actions and events in recent years. And I wanted to turn it over to him because he is going to talk about the recently passed American Rescue Plan and present a summary of some of the opportunities that are out there for public workers like ourselves. So Thomas, you are welcome to take it away.
Word. Thanks, Joaquin, and hello, everybody. Like Joaquin said, I work for the Vice President of CWA's public sector, and before that worked for a very long time at the University of Tennessee, Knoxville. So sort of familiar with higher ed issues and working in different job titles there, and glad to join y'all. I'm gonna be that person who shares their screen in our Zoom purgatory that we're all still living in. Talk really quickly about state and local government stimulus aid that's in the American Rescue Plan that was passed on March 11th of 2020 by the new majority here in DC. Want to first just say that this is different than a pot of money that in higher ed we're also really concerned about, called the Higher Education Relief Fund, which was passed first in the CARES Act, later in the Supplemental CARES Act in 2020 and reauthorized this year, that specified money for higher education purposes. This is a different pot of money that I'm going to talk about today. It's $350 billion that was put into the American Rescue Plan deliberately to try to offset budget shortfalls and the effects of austerity that were resultant of that due to COVID-19. And those pots of money are not mutually exclusive. So again, there's other stuff out there for higher ed that may implicate you and the bargaining unit you're in. A lot of the higher ed money goes directly to students, but a lot of it doesn't. But this is not that. This is money that goes directly to state and local governments, but that can flow into higher education institutions run by and funded by the state. So $350 billion in there. Huge, broad authorization for how state and local governments can spend it. The Treasury Department, which issued an interim final rule on May 10th, calls it flexible spending. So the way I've been talking about it to leaders across our sector and our union is as almost a menu. And we're going to have to figure out how to get our decision makers to choose from the menu what we want them to choose from the menu, because they don't have to do that. And I want to be really upfront about that the things I'm about to describe are options, but they're not stipulated expenditures. It's all just authorized expenditures, right? And I believe that Jamie and Joaquin and the leadership of UPTE are thinking about and will engage all in how to try to leverage this money at the bargaining table and in political mobilization to get a hold of it. So having said that and caveated that, want to just tell you some of the highlights of what's in there that's authorized. A lot is authorized. And today I'm going to spend most of the time sort of informing you all about essential pay, premium pay, hazard pay, whatever you want to call it, that's in there for essential workers who worked in person, and that's a big deal here, retroactive to the beginning of when the CDC declared a public health emergency and ongoing until the CDC suspends the designation of the public health emergency. So it's happening right now, and it goes all the way back to, I believe, March 14th of 2020. So premium pay, hazard pay, I'm going to talk about that a little more in just a moment in detail. Other important things for us to just know that the money is authorized to do is to restore public employment levels back to the pre-pandemic level, including by paying for payroll, benefits, and associated hiring costs at an indefinite timeline. That's part of what the interim rule is they're still taking comment on a couple of things, including the duration of some of these benefits. But authorized is the restoration of all job titles, layoffs, and furloughs that were enacted because of or under the rationale of the pandemic. And we all know that a bunch of these bureaucrats try to get rid of jobs at any chance they get. So it might not have been because of the pandemic, but if it happened after the designation of the pandemic, then that can be restored with the funds. Any lost public sector revenues can be replaced with these funds as well. So no state government, no municipal government out there can say, well, we lost a bunch of money and we're not able to do this anymore. No, there's sufficient money in here to plug those budget gaps using federal funds. Yeah, and the breakdown of those I'll share with you all in a moment, but all budget gaps can be filled, which allows for states to operate as if they have regular or even surplus budget years. There's stuff in there that makes investments in important infrastructure of two kinds, water and wastewater, including the remediation of lead pipes in both public buildings and residential, and then broadband stuff, which is of course interesting to our telecom sector in CWA, but is not the priority for CWA in this bill. Investing in public health and the fight against COVID-19, obviously public health departments, public health workers, hugely important and critical to solving the COVID crisis. And so there's authorized monies in there to expand public health departments, hire contact testers and tracers, et cetera. We're agitating at a national level to make sure that those people are hired as public workers and not contracted out to sort of outsourced consultant type folks who charge, you know, like $100 an hour, pay their people 25, while our folks are all making 20 with benefits or whatever. Other important investments that probably will affect many of our members, including support for K through 12 education, investments for housing assistance, et cetera, but aren't necessarily immediate bargaining table or workplace issues for the members. But there's information in this slide deck that I'm happy to share with anyone who wants it about all of this stuff, but sort of trying to highlight here what we think are the issues that are most directly workplace impacted. So the breakdown of who gets the money, states and DC get a little over half of it, and the rest is sort of distributed to counties, cities, tribal governments, territories, and very small municipal entities like folks that are less than 50,000 people. And you can click on any of those and see how much you get and what the formula was to calculate that, et cetera. So the premium pay is the big issue that a lot of folks are interested in, and that's why I want to spend a little extra time today sort of trying to talk a mile a minute to go through this with you all. The money is authorized to provide premium pay for all kinds of people who took on what the Treasury Department says heightened risks that they haven't been compensated for. And it authorizes the use of the premium pay monies to be spent on a huge number of job titles, as long as, and this is just an important caveat to this, and there's no flexibility around it, they had to have worked in person, regular in-person interactions, or regularly handled items handled by others. People who teleworked do not qualify for this. Now, if there were people who did hybrid work, and so they did 2 days a week in the office, my understanding of the law is that those 2 days do qualify for this, but the 3 days that you maybe teleworked, telecommuted, you are absolutely ineligible for that. Having said that, the people who do qualify for this are staff at basically any kind of healthcare facility, hospitals, nursing homes, home care settings, public health and safety staff, social services, human services staff, childcare workers, educators, school staff, kinds of transit staff. And then interestingly, and I think just important for us to acknowledge, because there are going to be folks who pursue this, a bunch of kinds of folks in the private sector that public entities can make grants to private sector employers to remunerate those employees for having worked in person during the pandemic. Farm workers, grocery store workers, restaurant workers, truck drivers, warehouse workers. The rule asks if there are other people who should be included in these broad categories. The rule does not list out job titles, understanding that depending on what institution you work for, state or local, the job titles vary greatly. These are big umbrellas, and it's about convincing or working with, however you want to put it, the decision makers that certain kinds of workers qualify for this. You can get up to $13 an hour on top of your base pay, not to exceed $25,000 additional dollars in pay per worker, going all the way back to the beginning of the pandemic, and again, ongoing until it's declared over by the CDC. And it can't increase someone's pay to over 150% of the greater state or county average annual wage unless there's a specific justification or exemption asked for. And in those cases, they'll be individually considered. So that's the premium pay. Just want to ask Joaquin or Jamie if you all want me to stop or want me to say a little bit about any of the other provisions or take questions, whatever. Just want to make sure that we got through that part first.
I think, given that we're running a little bit behind, I think it would probably be
cool
if we moved on.
You got it.
We can continue to answer questions. I know that folks are going to have more questions about this. I wanted to share something really quick about how we can push for this. And just to answer a couple of questions that I'm seeing in chat, like folks are asking if technical workers who worked on site are going to be eligible for this. If we win it, it would apply to folks. I mean, I myself, I'm a technical worker. I know Ben here at Davis. We were both working on site for the entire time that we were working through the pandemic. So yes, it would apply to anyone who was working on site in that kind of essential role. So let me just go ahead and share real quick some information. I wanted to provide this visual so it'd be easy to make a note about it for everyone. How do we collectively make a push so that we can get this, so that it is an option for those of us who qualify? And many thousands of UPTE members do qualify. It's not just the healthcare members, although it is many of those as well. We want your testimonials so that we can send a strong message to politicians like the governor who have the power to disperse this retroactive hazard pay. So we need to start by sending that message. Then we can follow up with things like calls, like letters, and like further actions that make this more and more visible. We want to make sure that there's a press presence around this, that we say that, the people who worked and the people who suffered the uncertainty and the risk during the pandemic get some sort of compensation and acknowledgement for all the sacrifices that folks have made and the contributions that we made to keep systems like the UC running. So please email UPTE's political director, Adriana Acosta, at acosta@upte-cwa.org to get in touch. We will work with you to provide those, so that you can provide those testimonials. They really send a strong message. It's always more powerful when it's not just those of us who are elected communicating about what the members, are experiencing, what the rest of you, all of us who are doing this work are experiencing, but that it's those voices are coming directly from you. So we will make sure to move on that. Let me go ahead. I'll stop the sharing. And then, I know we've gotten some questions. It's nothing, and Jeff, to your question, nothing's currently guaranteed. We got to make a push so that this actually goes through. We know that the University of California doesn't necessarily take advantage of all the options available to them. They often don't take advantage because of the work that's required or the complication or their own sort of problems with their administering the system. So we're going to have to be, proactive in terms of making this a reality. So I know there's a lot more to go through. I'm going to just blow right through this next section on our agenda because it's important that folks get to hear about new members who are joining the union. So I'm going to go ahead and share screen one more time. So we'll spend 30 seconds, maybe a minute at most on this. We'll try and move past, and let's talk real briefly about new organizing, about growing the union. As of this month, we are confident that museum educators, a title that works closely with a lot of our folks who already work in the museums, are going to be a part of UPTE. They have organized really powerfully for representation. They've filed the necessary paperwork with the Public Employment Relations Board. We're waiting on a response from the University of California, and we expect them to drag their feet as they always do. But this group is very well organized. They're working with a great team, including assistance from CWA, from our international, that we're getting help with to make this work happen. But I wanted to put this message out there because there are a lot of other workers at UC who still need a union. There are tens of thousands who don't have representation, who are out there working on the front lines. Some of them don't have representation because UC has made an administrative decision to try and break apart work groups, to try and shift one job title to another, so that they can avoid union contracts that add, cost to them, but they add benefits to us. So if you or someone you know is looking to join a union, to get organized, to win the benefits of representation, email organize@upd-cwa.org and get in touch. We have the team that's working on these projects will be in touch with you if you do that. So I want to make sure to drop that information in. And I may have gone out of order here, but I know we're going to have a very quick systems administrators bargaining update. So I'm going to hand it off to Eric for that.
Hey everybody, this is Eric Wise. I'm the RxTX coordinator and chief bargainer for the systems administrators. Quick update. I'm not going to spend very much time on this. We meet every week on Mondays. We have channels, and the LDCs are currently involved. If you haven't been getting anything, please reach out. We're doing the best we can to try to get everybody. We do have, this is the big news, is that we do have our date set for our first official day of bargaining, which changes a whole number of parameters around how we organize around getting you guys what you need. The date that we will meet, the very first date, and again, these are all open. So please show up to these things, and I'll, once we have it set with an actual link, you'll get the link and so on and so forth. But the date is going to be July 7th. So July 7th is going to be our first day of actual bargaining. Okay, and we've been working with the university to gather all of the data to figure out what kind of merits people have gotten, what kind of pay increases over the last few years. Because we know that a number of almost everybody since 2017, when back when the systems administrators actually voted to be in the union, and since UC has been fighting, a lot of you guys have fallen behind on raises, and to our calculations, they owe at least 12.5% of raises to most of you. So far, we know that we can get that much, but we're also going to be pushing for equity increases because you guys are way far behind and way below where you need to be for where you should be and how much UC relies on you, and you all know this. So one of the problems that we have been having is reaching everybody. So if you happen to know a systems administrator, there's a lot of misinformation still out there. Some people aren't getting the information. Our LDCs are reaching out, trying to find them. As we're getting information from UC and finding new people, we're trying to reach out to them. So anybody that you find, reach out. We have a bargainer for each campus. You want to reach out to them and the local leadership development coordinator, and they'll get you in touch with myself and the bargaining rep, and we can discuss how we're going to move forward and actually build out so that we can get you the money that they owe you, because they do owe you this money, and we are going to get you that money. Okay, and the more involved we get, the more help we get, the more equity we can get for you, the higher the pay raise, and the quicker we can get it done. Okay, and that's basically the report. Is that, yeah, starting July 7th, it's on. Thank you.
And I did see a request for an update on behavioral health counseling. We are still working with the university to get all the information on the employees that fall into there and their current pay raises or salary and any raises they've received recently, so that we can get that bargaining going. The university is, as always, very slow in coughing up any information. But I will say going to tap into some of the systems admin guys. They have become quite the masters of demanding and prying the information out of the university, up to and including telling them exactly how to pull it from their own system. So they are fantastic resource and a great addition to our union, let me just say.
Okay. Okay, so I noticed there was also a question about speech language pathologist 3. That one I believe was introduced just at San Francisco. Jamie, do you have just like a quick word on that right now?
Yeah, that's a local bargaining. So they've started, I think they're trying to set up dates on that one. I know that we also got a request about if we can be expanded, and I think Joaquin had some information on that, but that they're setting up the dates because right now the only folks that are in that title are at San Francisco, and so they're bargaining that pay scale locally.
Right. With that, I know that like all of this stuff, there's a lot of good information coming out. It's also generating a lot of questions. We got some in advance that we want to make sure that we cover before we let everyone go. And you can continue sending questions to questions@upd-cwa.org. We'll do our best to get back to everyone who inquires. But let's go ahead and knock out these questions that we received in advance so that we can make sure to do those justice. So I know this first one I was going to pitch to Jamie. It was from Ben at Davis. And he was asking, about how the UC is working on a plan to mandate the COVID vaccine and presumably continue mandating the flu vaccine as well. He was basically asking a question about whether there was any sort of issue with privacy around the mandate for folks to wear a mask if they haven't gotten the shot. And I figured I'd just give you a chance to explain that situation and what to expect.
So the flu shot vaccine mandate has been around at the medical centers since approximately 2011, I think is when it first rolled out. There are rules and regulations on mandating vaccines because obviously healthcare workers beyond the flu shot have had vaccine mandates for decades. Cal OSHA does allow for there to be, for an employer to protect their workforce, as in, it's always existed. If you did not get the flu shot, you'd had to wear a mask during the flu season. And there's talking about doing the same thing, including testing if you decline the COVID vaccine. And let me, by the way, clarify, we are still meeting on the COVID vaccine. We have our first meeting on that on the 9th to work some things out on it. But the COVID policy allows for declining it based on medical, religious, and personal strongly held beliefs. So it's not necessarily a HIPAA violation to have you wearing a mask. It doesn't necessarily say that you have a medical reason. There are multiple reasons that you can be declining that vaccination. And yes, it does include medical, but there are also non-medical reasons. Cal OSHA has always allowed for the flu shot to mandate a mask and to protect the workforce. There's going to be, you're not going to be able to fight it as far as for the COVID vaccine. And it's not a HIPAA violation because there are multiple reasons why you could decline it. But stay tuned because there's still bargaining. And please, you have other questions or issues or things that should be discussed during that bargaining, send it to questions@UPTE because, that's your chance to really have input in this process.
All right, thank you. Yeah, this next question comes from San Diego, and it was actually relating specifically to that speech language pathologist 3. And the question is, I was hoping SLP 3 at UCSD would be discussed or given an update. It's in the contract, but it has yet to go into effect. Management keeps stating it is stuck at the level of the regents. Any guidance about how to get this implemented would be greatly appreciated. So there are 2 levels on which we can talk about this. And this is true of anything like in this case, where the contract doesn't give us the power to demand a certain title is going to get extended to a campus. So let's start with that. And, it would be nice if we could just turn in a form and say, we want this title here, let's get it done. Unfortunately, the university doesn't give us that ability right off the bat. On the other hand, we do have a history of being able to extend some job titles that appropriately apply to the work that folks are already doing to various campuses. A few years back, we did this with principal scene technicians at the department I was working in, and that was a big improvement for a lot of people who got moved into those job titles, and for some people still should be. But the point I'm making is that there are ways to organize around an issue like this, even if it's not a power that's granted to us directly by the contract. And if we have the standing based on folks who are doing the work and people are willing to make a statement about it and they're willing to push the administration, we can give it a shot. So we'll want to make sure that that is something that we can work with your local staff, with your local leadership, so we can bring attention to this and push for speech language pathologist 3 to be extended to UC San Diego campus.
And I will just add, they're probably not going to extend it there until it's bargained and finished as part of an accretion, because there's some tweaky things, and then it's a lot easier to roll it out to other campuses, just as an addition.
Right. That covers the other portion of the question. That's right. This next one, I was going to hand off to Jamie again. This one comes out of UCLA, and the couple of different questions. One of them we kind of covered, and thanks to Thomas in the American Rescue Plan. Does UC have to apply for the new money for hazard pay, or would individual campuses or departments need to apply? So it starts at the governor's office level, and then we have to work with making sure that it actually gets pushed at UC, and that UC will indeed work with the politicians in actually dispersing the money, or agreeing to disperse the money if it's granted. So I'll just getting that one taken care of. But so 2 questions remain in this. Would employees who have left UC but worked on site during COVID get back hazard pay? And UCLA is going through career tracks, and I wonder if any current UPTE titles will be affected. Would anyone be moved out of an UPTE represented title? And in fact, would we be able to organize titles that UC is creating that overlap with current UPTE represented titles? So there are a couple of things in there, but Jamie, do you want to chime in on those?
Sure. Most likely, we only have as a union the ability to negotiate for people currently employed. So those who have left but worked during the pandemic on site, we can't really do much about trying to get them this bonus pay. I will say a caveat, and it's again not something we have control over, but I did see something that if they move employers, that the employer they move to may be the one required to go after the money and give it to them. But again, that's kind of out of our purview. As far as career tracks, the university is constantly moving titles and people around anyway. So certainly that can be, that happens every day anyway, but and yes, they could certainly be trying to move people, and they do it all the time, out of represented titles. It's our job to kind of watch on that, make sure that they don't, that they're not doing that, that's basically what's called in the union world theft of bargaining work, because a lot of times they change their name and title, move them out of the unit, but they're still doing the exact same job. So guess what? That's really nasty on them and illegal. So it's our job to police that and make sure that they behave.
Great. No, thank you for that. This next question, I'll start with just clarifying. We've got some good answers for this, so don't interpret the question as a statement of fact, right? So we got a question saying, as a result of COVID-19, we did not receive any raises that were programmed to happen. Are they canceled or postponed? And I want to be really clear here that employees of the university without union representation last year did not get their annual raises, and in part due to pressure that UPTE was placing on the university administration. Those folks are indeed getting their raises this July, but UPTE members have not had any cuts or any takebacks in any of our bargained raises. So this year in April, there was the possibility that UC could try to use the pandemic as an excuse to reopen negotiations on our contracts. But because we rallied, because those of you on this call signed our petition, our safe haven petition, we were able to shut that down. So April came and went. No new negotiations on the contracts. All of the raises, all of our pension benefits are safe throughout throughout the period of our contract. And then, as usual, we'll go into new negotiations in 2024. But everything is safe. You haven't had any takebacks. Research and technical workers are getting 3.5% this July. And there's also step increases coming for everyone this coming January. Healthcare workers got their step increases this January and are getting 3% this July. So everything is on schedule, on track. All those raises are secure, no attacks and no cuts on retirement. So I just want to make that crystal clear, especially if you didn't make the town hall last month or didn't see the announcements that we put out about it.
So because of you, because of our support and working together, we stopped the reopener. All of our raises are solid and secured. All that stuff that we fought for 2.5 years for, we will get every single bit all the way through January of 2024. So good job, everybody. I'm going to cover some of the questions that I got on paid for family bonding. We will be saving the chat. I'll incorporate a bunch of these into the FAQ document that I put together. So it may not get up until tomorrow, but and we'll email it out to all of you who attended so that you get it also directly. So a couple of things. Oh, and let me say on the pay for family care and bonding, this is a start. With the university, it was presented as, do you want to be a part of it or not? Take it as it is or nothing at all. So obviously we want this. It's a benefit for everybody. We signed, we joined. It is good. We are all now able to use this benefit, but it has some things that need to be worked on, some tweaks, some things. And guess what? Bargaining in 2024, that's going to be one of the things we work on. So as it is now is what we have until 24, unless the university changes anything, but we can always bargain it better. And that's the power of a union. And that's the power of us working together. So can we take paid family care and bonding in addition to maternity leave, then 12 weeks of baby bonding, and then 8 weeks? Not quite. So you take your maternity leave, and then when you return for that medical portion of it, you're qualified for up to 12 weeks of baby bonding. And this provides pay for 8 of those 12 weeks. So this is not in addition to baby bonding. This is pay for that time if you don't want to use accrued leave. Is there any retroactivity built into this? My daughter was born in December and I used all of my sick time at that point. So the leave is not retroactive. It goes effect July 1st. Now, it depends on what you did last year. And this is for anything. So there's another one about FEMLA that was very similar, but there may be an opportunity to still use this. So if your daughter was born in December, but you didn't use the baby bonding time then, because you can take it anytime in the first 12 months after the birth or adoption of a child. So it's also good for adoption. So if you had such an event and you didn't use the bonding time then, you just came back after the medical leave, then you still have that opportunity to use those 12 weeks. Or if you only use part of it, because you can break it up and use it in different pieces, you still have that opportunity. Starting July 1st, my understanding, and the university, this is one of those things the university has not been that clear about. They keep saying it goes in effect July 1st. So if you still have baby bonding time available as of July 1st, you can use this for pay to go back and use that time, because that time, those 12 weeks, don't expire until December if your daughter was born in December. So if you didn't use it all then and take it as leave without pay, then you can still use it now and get paid during that time. Another question. So it seems it'd be better than leave without pay, but if you have accrued time, you'd be paid higher. That is correct. If you've got, like I said, one of those big banks of paid time, you were saving up because you knew this whatever event was coming, then you could use that paid time, and it would actually pay you. You could use it up to, use it to get paid 100% of your paycheck, and paid time, you do get your shift differentials on that, which, as obviously, as I mentioned, you don't get here. But you have an event and you don't have that big bank, this allows you to get paid for 8 weeks instead of taking leave without pay. So this is a substantial benefit, obviously, than in compared to receiving absolutely no pay whatsoever. So that is, it's a huge benefit at no cost to us. So that's, which is great. Another question, does this protect your job? This pay does not protect your job. However, to qualify for this pay, you have to qualify for one of those things I mentioned: FMLA, military leave, extingency leave, baby bonding, and all of those are protected time. So your time is protected. This is just about pay. We always talked about before with FMLA, with FMLA for a family member with paid bonding time, all of that was job protections only with no pay associated. This is now the pay to associate with it. And one other one I wrote down, so if you will be out on FMLA on July 1st and still have 6 weeks of FMLA leave left, can you use this leave? My understanding is yes. So say you went out, sometime this month, you're going to be out for 12 weeks for whatever, caring for whatever, or you still have your baby bonding time left as of July 1st, you can use this for pay. And this renews every calendar year. But for like the FMLA, you have to have 1,250 hours. So you can go out, you can have this benefit as long as you've had accrued 1,250 hours rolling time prior. Every calendar year it renews. It's available to you every single year. So you use 8 weeks this year, you come back to work, you work your first 6 months, something happens in December, you have another baby in December, for example, or not quite December, sometime end of next year, you can have another 8 weeks. There is no limit. It renews every single year. Can you use this benefit if your family member lives abroad? It's not about where they live, it's about if they qualify in the FMLA. So parents, it's children, there's a certain level that it can go out, like grandparents, I believe, qualify in FMLA, and I did not read it right before this, so do not quote me on that. It is very well written in our contract, but they have to be one of the qualifying people. Doesn't matter if they, if you have to go abroad to take care of them. It's not their proximity, it's their relationship to you. So hopefully this was a great information for everybody. We really want to thank everybody for attending and for listening. Again, send us your questions, please. If you have topics that you would like us to cover, also send those to questions@UPTE. Do we have bereavement leave? Bereavement leave requires use of sick time. You have the right to the leave and the time off, but it requires the use of sick time. It's not paid. That was actually another thing that was on my list of trying to get on our last contract, and it'll be on our list next time. But because the state pays bereavement, I don't know why the university doesn't. They're just cheap. But anyway, if you have topics that you would like to cover, that you would like to discuss, bring information forward, please send us those topics. This was a great thing that just rolled out, so it was easy to know what to bring it to everybody. But again, we're always looking for new ideas to do these, and we're here for you. You tell us what you want to hear about. Joaquin?
I don't have any more to add except to just really thank folks. I mean, most of you stayed here for this full 50 minutes. We were planning on 30, but we got so many good questions about the paid family leave and about other subjects about like the contracts and everything that we want to make sure to answer as much as possible. So thank you all so much for being here. It was really great to see so many people show up and sharing all the information. So by all means, remember questions at UPTE. If you've got questions, you want to share something, you want to share an idea for a future town hall, if you know people who want to organize with us, organize at upte-cwa.org. Really looking forward to seeing everyone again soon. Have a great day. Take care. Thank you for being here.
Bye, everyone.